Hello, my name is Aaron Petra. I'm one of the physician assistants working at the Institute for Minimally Invasive Spine Surgery in Holyoke, Massachusetts. We operate out of Holyoke Medical Center, and today we're going to be talking about one of our minimally invasive spine surgery options, the minimally invasive lumbar spine microdiscectomy. To start off, we'll discuss the indications for surgery. Most commonly, the indication for this surgery is a disc herniation. If you look at the image on the right-hand side, it is an MRI of the lumbar spine with a large disc herniation at L5S1. This particular disc herniation is accompanied by something we tell all of our patients to look out for in the context of a disc herniation. It's called cauda equina syndrome. It's when a constellation of symptoms present, typically all at once. Bowel and or bladder dysfunction, reduced sensation in the perineal region, new onset of sexual dysfunction, and neurological deficit in the lower extremities, such as motor sensory loss and reflex changes. On the left-hand side, you'll see an MRI that is normal of the lumbar spine for comparison. The potential benefits of surgery. So resolution of severe leg pain. Our patients typically present with fairly severe leg pain secondary to their disc herniations. Resolution of numbness and tingling in the legs, which is on a case-by-case basis. Resolution of back pain in some particular cases of disc herniation. Most commonly, if the disc herniation is paracentric, pushing on the center of that cauda equina, our patients can experience some degree of back pain, which may be relieved after surgery. Improved gait, ability to walk better as a result of the pain in the leg being relieved, and improved strength, also as both a result of the pain in the leg being relieved and the nerve compression being relieved. The expected hospital course for this surgery. So you arrive on the day of surgery, you check in with our preoperative department and meet our nursing staff. You'll meet Dr. Pennings before surgery and sign a surgical consent form. You can ask us any questions you may have prior to the surgery at this time. You're going to meet our anesthesia team, who's going to put you under for general anesthesia and make sure that you're safe to go under for surgery. After the surgery, which takes about an hour or two to complete, you'll wake up in our PACU, our post-anesthesia care unit, and the nursing staff will help reorient you after you've been put under for general anesthesia. Once you're stabilized and oriented, you're usually discharged by mid to late afternoon. So it's same day surgery, come in and leave the same day. Surgical procedure. So after intubation, we position you on something called a Wilson frame, which is this frame bed, essentially, depicted on the left-hand side. This gives us good access to the lumbar spine. We sterilize the surgical site with iodine. We take a surgical timeout to confirm patient information and the proposed procedure. The surgical approach. So on the right-hand side, you'll see an image of a minimally invasive spine surgery incision. On the left-hand side, you'll see a traditional open spine surgery incision for a discectomy surgery. The obvious benefit of the smaller incision is a quicker healing time and better recovery. The surgical approach, after Dr. Pennings makes a small incision on the midline of the back, he goes down to something called the spinous process, which is the prominence you can feel if you run your hand over your lumbar spine, sticking out your back. He goes down one side of the spinous process to this bone called the lamina, and he makes a small hole in the lamina so that he's able to access the ligament, the tissue, and the disc that's underneath the lamina bone. Once the disc herniation is found, it's removed. The picture on the right-hand side is an image taken of a disc herniation piece of disc material that we removed next to my hand for size context. Once that compression is removed and we can feel the nerve is free, we proceed to closure. For closure of the incision, we have sutures placed under the skin subcutaneously that will dissolve on their own, so you won't have any sutures you need to have taken out in office. We put steri strips over the top of the incision that stay on for about a week until they eventually fall off on their own or are taken off. And for recovery and follow-up, we're fairly strict about our weight restrictions after microdiscectomy surgery. We want patients to stay at about an 8 to 12 pound weight restriction. This helps to reduce incidence of something called recurrent disc, where another fragment of disc material will push out of the disc space. We want you to limit bending, lifting, and twisting, BLTs. We want you to walk as much as you can. We recommend to walk in total about a mile per day. And we'll follow up with you in clinic in 2 to 3 weeks to make sure you're feeling okay, your incision looks good, and refill any medications you might need. I hope that was a helpful overview of our minimally invasive lumbar spine microdiscectomy. If you have any questions, feel free to call the office or make a follow-up consult visit with us. Thank you so much.